All
Um,
right.
are we ready? Let's do it.
And we're ready.
Five, four, three, two. Welcome to another episode of the Mid Level Show. We are so excited here because we have a new provider in the room. Amber, would you introduce us to this future PA or future nurse practitioner right there sitting on your lap?
This is Ben.
Ben is ready in
Again.
action. Ben is really excited to talk about belly fat today, okay? Because I'm sure he loves tummy rubs too. So
He
he's
does. And
all
look at
about.
this. Look at this.
Look
at
at
Oh
that.
my goodness.
We are all about the belly fat today. Now, Ben, you're allowed to have that, okay? Oh, and now he knows we're talking about him. He knew. He just knew. But no, we are so excited to have Ben as a guest on our show today. And we have all of our mid-levels of performance medicine. We have Fran, we have Kara, we have Amber, and yours truly representing the mid-levels in all three locations. And today we're talking about belly fat. If you want to tune into something, I'd tune into this one because everybody talks about it. Oh, Andy, I'm doing everything I'm supposed to be doing, but I feel like my gut, it just hangs all around that. How often have you heard that in a room? That's where I hang with it all the time. It's because that's a good thing. That means that there's some solutions to why that's happening. So I just wanted to go around I was going to say the room, but are we like squares? I feel like we're in the Brady Bunch. Like start to the left and do squares today and just kind of get your first takes on belly fat and maybe some of the misconceptions we have with belly fat. One that Dr. Rogers talks about is that, they're just lazy. And I feel like that's something we can immediately cut out if you're listening to this and you struggle with belly fat. Most often it's not due to laziness. Fran, what were kind of your first thoughts? Fran represents our Johnson City office, now taking patients on Thursday mornings.
It's not your fault, I think, was my first thought. I mean, that is definitely true. And that it truly is a metabolic problem. It's not a laziness or you don't exercise enough problem or that you don't eat right. I mean, there's many factors. I mean, eating makes how you eat does make a difference. But just because your fat is all accumulating on your belly points to inflammation and a metabolic problem, which we are great at helping you solve at Performance Medicine.
Which means get your hormones checked. Get your lab levels checked. Absolutely. I had a patient come in this morning, a wonderful patient who has struggled with PCOS. And I know a clinic down in Florida. If you have PCOS, this is polycystic ovarian syndrome, usually from high testosterone, high insulin, high cortisol levels. Insulin is a driving factor in these patients gaining weight and also pertaining to infertility. And you get put on a track immediately. Either you're a metformin track or you're Ozempic, which is a GLP-1, my favorite drug in the entire world. I'll stand on a soapbox somewhere in this room next to Ben's UT poster, my sister's UT painting there, to talk about Ozempic. But getting your hormones checked, seeing where those levels are. She had high insulin levels, and there's ways to target it. And it's going to be hard to lose belly fat if you have high insulin levels. Kara representing our Knoxville office. What were your first takes?
Well, I know Dr. Rogers has said also it's the most dangerous. We call it visceral fat, and it's also very difficult to lose. And that can be very frustrating for patients. They complain about it around the midsection. They may be working out, their arms and legs may be nice and toned, but it seems like right around the midsection is very difficult to lose. And that can be frustrating, and they feel like they're doing everything they can. So True. It's a difficult area to target.
Absolutely. Difficult area to target just with exercise and diet alone. He does mention in the note too about watching your carbohydrate intakes. We talked about insulin. Insulin, I explained, I love insulin. I have type 1 diabetes. I have for 16 years. My sister's had it for almost 26 years. Insulin responds to glucose, which comes in the form of carbs. So low carb, I'm not giving insulin most of the time if it's under 5 grams, which is why these low carb diets work, or low carb nutrition plans. I don't even call it diet, low carb nutrition plans, where your body is sending out less insulin in response because it's not it's a hormone. It's a lock and key. It's supposed to go out and make a change. less carbs, less insulin. So you're totally right about response to food and also to exercise too. Sometimes exercise, we need it. It drives up your natural testosterone levels. It helps out with mood. It helps out with your metabolism. But it's not just the cure-all, fix-all for belly fat. So it's other stuff we have to investigate. Get your hormones checked. Amber, representing our Kingsport office, yeah, and Ben as well. So sorry, I didn't mean to ignore you there. What was your first take from this?
Well, this one was really personal to me because my husband, who I don't know if he'll listen to this or not, but it's not called a dad bod; it's called a father figure because it is Father's Day, and he has been experiencing this change. And he's in his 30s, so it's not like he's just got this massive gut, but just in ways that he'd ever had before. Just the weight going through his abdomen. A lot of his has to do with stress, like Dr. Rogers talked about. We have 3 kids. He's working. I'm pretty much stay at home, except the little I do with performance medicine, and exercise has gone down a whole lot. But also, as Kara was saying about the dangers, his dad had a heart attack in his 40s. He's got heart disease in his family. And so I had an uncle, 47 years old, who was not by any means super overweight, but did carry some weight in his midsection. He ultimately had open heart surgery last 2 years ago this summer with a 98% blocked LAD. It's just, I think heart disease sometimes, not always. So if you have some belly fat, don't be like, I've got heart disease. Right. It is something to consider. Do you have a family history? What are your other, like we were talking about, the whole metabolic picture. And so that was one of my takeaways. And I really hit home the diet portion, kind of made me like, ouch, because, the high fructose corn syrup and things like that. We have a lot of gummies in our house and goldfish, and so I'm checking the boxes a little more intentionally.
I think that's a great thing, especially too about the fructose. Dad has been on a rampage about fructose. Okay, fructose coming from fruit. So most people get the misconception that fruit's good for you. Some would argue that fruit is not good for you. Some would argue that it is. It has fiber, can help your bowels move along. But fruit is high in sugar. Most fruit is high in sugar. And you can get, it's all about balance too. You can get potassium from bananas, but you're thinking about biologically and looking at it from an anthropological look. It's about your brain gets rewarded for finding things that feed you. So sugar is rewarding, dopamine dumped from sugar, from fructose, in order to find the food again. So that's why that's why species survived. They found the food and stayed near it, especially for those sugars. So for fructose, it spikes so quickly in your system. We've explained on previous podcasts, I don't know if it's the mid-level show or the carb show or the carb watch, but whenever you're bringing up a patient with a low blood sugar, you choose fruits. You choose fruit juices, orange juice, apple juice, quick. Those are quick carbs because they're in your stream very fast and out very fast. For a low blood sugar, that's great. But any other time, you are spiking that insulin level really, really quickly. You're taking care of the sugar from the fructose, and then you're storing the rest as fat. I tell a lot of patients too that insulin, what it does, it's a director, and it's a parking garage director. You have a very small parking garage where glucose needs to go into the cell. Another small parking garage where glucose goes as glycogen into the liver. The rest is an open field where all those cars get parked in as adipose tissue and fat tissue. So more insulin, and the more insulin quickly, more opportunity for belly fat storage, which again, Amber brings up a good point. Increased risk for heart disease. And I think too, I think you bring a great point that just because you have belly fat doesn't mean you have heart disease, but it's the things that are contributing to that belly fat is a signal for what could be a risk factor for heart disease. There's probably someone, can y'all explain that better than I'm explaining that if someone wants to jump in? It's all about risk factors. It's not just the fat. It's what's driving the fat there that is risk factor for heart disease. Those are all great points. I want to talk a little bit. He brings up specific markers. He brings up testosterone. He brings up estrogen. He brings up cortisol. He brings up insulin, and he brings up lipase. So I was like, check. Lipase. Huh. I need to know about that, because all I know from PA school is that lipase levels, I'm thinking pancreatitis. So yeah, I'm like, that's what I check for, pancreatitis, not belly fat. So I looked it up. Lipase, it helps break down fat. That makes sense. Lipid, fat, ACE, break down. It's an enzyme that helps break down fat. So you want more lipase to help break down fats, especially if you're bringing in more fats. Some people actually supplement with it. This may be a question for the group too, but I tell a lot of people to do AMPK metabolic activator and adipocyte or adipocyte. I probably butchering that. Do you guys recommend any of those vitamins? Kara, you're shaking your head. Do you guys use that a lot down in Knoxville?
We do use it also too. I've read where patients who have trouble losing weight have low vitamin D levels. And so that's another thing that's really important too. The average person might have maybe 36, but we like it about 80. And I think yesterday I had a lady who was 26. So that's also very important. And also people who have low vitamin D levels, they have trouble losing weight. So that's another important thing to check.
If I had to choose a vitamin to be my best friend, it would be vitamin D. And that best friend would be 5,000 to 10,000 IUs daily. And if I were over the age of 50, my best friend would be vitamin D with K. I love vitamin D. Like, I love it. I get a shot every freaking week of vitamin D. I feel better. My immune system's boosted. And I've dealt with insulin deficiency and not insulin resistance. So therefore, weight hasn't been an issue in my family just from genetics. But I do feel the benefits of vitamin D. So that's a great point. I feel like everybody should be on vitamin D. And Fran, too, if you want to speak to that, I've been with Fran in the room. She likes getting her patients up to 50 to 70, and most labs will tell you optimal is above 30. Do you find that?
Always over 50.
Yeah.
I've never read anything in alternative literature on vitamin D that doesn't want you above 50.
Yeah.
Even just for your brain to function the way it needs to function. And right now with COVID going around, I mean, boosting your immune system with vitamin D is kind of a no-brainer. You need to do it. But I would prefer to get my vitamin D from a vacation in Hawaii.
Hey, I'll talk to Dr. Rogers. We do deserve it after this podcast. This is a lot of work. We do need a vacation. We'll do just a quick case study with the four. I'm getting a note from production that's not actually going to be available to us, but maybe in future, when future offices open, maybe when performance medicine becomes the next, I don't know, PALS or something, we'll get that vacation. I'll put it into the big guy upstairs. Perfect. Sorry, what were you saying? You want to get it from the sun. Yes. Vitamin D, natural vitamin D absorption. You do need it activated, which is why we like vitamin D3. And we're kind of big on shots too. And Kara and I talked the other day about kind of how do we dose it. Our kind of baseline is 5,000 by mouth a day, but we do offer, and a lot of offices offer 50,000 IU injection through 1 cc vitamin D3 injection. We've been on the fence about how often we do that. Did you find any more answers about? I'm saying I do it once a week. Apparently, it can increase your risk for kidney stones and that formation. So you kind of have to take it carefully. Starting off once every couple of weeks or once a month definitely won't hurt. But I want to change gears and I want to talk about insulin sensitizers. He talks about metformin, which is a big one, and everybody pretty much knows what metformin is. Berberine, which I call the natural metformin. I think it's great for those who cannot tolerate metformin due to GI side effects. And Ozempic. Ozempic is the bomb. So,
are you having any luck? I'm sorry to
go
about Ozempic, getting it for patients. I mean, it's a great drug for insulin resistance, which, we've talked about insulin and belly fat and, but how do you get it covered for your non-type 2 diabetics if you can't sample them? Are they getting better coverage for that?
They're getting way better coverage. At least, actually, great. I think better coverage in Kingsport than Johnson City, and Johnson City's working just as hard too. Awesome. Sometimes they want to see that you've tried and failed other drugs that are in the type 2 diabetes profile. It's not necessarily, sometimes the prior authorizations want to see a specific diagnosis, but you can add an insulin level on there.
Right, exactly.
And so I think getting insulin levels drawn is good if you're having trouble with coverage, but really you can, most often you can tell someone's going to have high insulin levels or higher insulin levels even without necessarily drawing it. But there's other two. Oh, I'm sorry. We're getting a call here too. That's going straight to our phone. I'm on production staff's phone. You're getting a call from your daughter. If you'd like to answer that on your cell phone, Jenny Rogers. Perfect. No, she says no. So we'll just go ahead and decline that. Thank you for joining in, Kelly, my sister, into the Mid-Level Show via cell phone. She's not. I'm kidding. Okay. But Ozempic. So Ozempic is a GLP-1 receptor agonist. I just described it this morning, and did I talk about how I talked about it was a basketball coach last week? No? Okay, this is an analogy for the ages. Are you ready? Okay, so everyone has GLP-1. Everybody in this square right now has GLP-1. It's like a basketball coach. Your arena, the GI track, is a basketball court, but it's an NBA basketball court. Most people's GLP-1, that coach, is like a middle school basketball coach. And he only has middle school players to work with. He's going to send out 100 middle school basketball players to play an NBA game. So think about that, sending out insulin that doesn't work as well, that's not as good, not as efficient, into an NBA level game. They're not going to get anything done. They're going to flood the court. No baskets are scored. GLP-1 receptor agonists like Ozempic comes in and replaces your coach with an NBA coach who's going to send out 5 amazing NBA basketball players, 5 amazing insulin players to play the game for you. That is how Ozempic works. So it's an insulin sensitizer in response to food. It's an amazing drug. And I think that for those who have struggled with weight, struggle with that belly fat, and kind of have a known family history of diabetes or prediabetes or sugar issues, Ozempic is a great way to start. They're changing some of the algorithms too. So most often you have to start with metformin right off the bat as the gold standard, but most often they're pushing that GLP-1 up to kind of the top level, where you can even start patients on it without metformin. Do y'all use anything other than Ozempic? Ozempic is technically a once weekly, but just buzzwords for those listening: Victoza, Saxenda, Bydureon, Byetta, Trulicity. Those are all part of the same. Even Rybelsus, which is the first oral version of it. These are all injectables. Any success with other ones that y'all have tried?
A new one that's out in relation to heart disease as well and lowering your insulin levels, Farxiga. It's oral, it's daily, and they've just come out. I watched a education type thing on it from cardiologists and how they are putting patients on this first line. So, that just because of the heart benefits. So.
Yeah. And two, we talked a couple weeks ago about tadalafil and heart. I mean, there's a lot of medications that benefit the heart as well. So I think that's great. A lot of those medications are coming. Farxiga is an SGLT2 inhibitor. It works on the kidneys to spill more glucose out of the blood. It helps lower glucose levels and lower A1C levels. Another great medication used for a diabetes, prediabetes, sugar issue.
But if you're just the average person listening in and you've got belly fat and you're a guy or a girl, you don't necessarily have to jump to pharmaceuticals.
Right.
Look at your risk factors, look at your diet, look at your hormones. How old are you? What's your body type? What's your family history like? And kind of get an idea. And I think Dr. Rogers gave some great ways to start with just diet, the things you look at in your diet, the things you look at in exercise, those modifiers, and then kind of go from there.
You bring up a great point. He talks about fasting. Does anybody kind of have interest in fasting or intermittent? I know Dad does an intermittent fast. Intermittent just means not a full fast. He does 16 hours of fasting, 8 hours of eating. And the idea behind that is that the less often we're eating, the less often insulin has to come out and play. So it's just like we're turning the lights out on the basketball court for a little bit. Fran, do you have any advice, tips? What do you think?
I love intermittent fasting. It's easy for some people, and some people actually feel better when they're fasting. Their brain works better. Everything feels better when you're fasting. Some people do not. My husband could never do it. He gets way too hangry. He needs to eat as soon as he gets up. So it's an individual thing. Learning to eat when you are actually hungry is a great way to go. I found out that I really don't get hungry till lunchtime, but I was just eating breakfast all the time because you're supposed to, and that really doesn't make any sense.
Right.
Adding something like C8 and caprylic acid, medium chain triglycerides, that that can really help you burn fat too.
For
Bulletproof
sure.
coffee, where we put the fat keeps you full, so it's not really complete fasting, but it's a form of fasting,
Right.
where you can have your caffeine and your MCT oil, and you're good to go.
I like that.
Usually
Very
easily till
brain
after
healthy.
lunch. So, and if you want to ever try fasting, I suggest you just try to go a little longer each day for a while. Don't make yourself suffer. You will find out when you really need to eat. Don't let your blood sugar drop so low that you're miserable.
Right.
But everyone should give it a try and just close that window of when you actually eat. As long as you know you're allowed to eat, a lot of people are fine with it. Like, they're going to eat between 12 and 8.
Oh, absolutely.
And just see what it does. It does make you more sensitive to insulin.
There is a great website. Oh, for sure. Absolutely increases
and
your
it's
insulin
anti-aging
sensitivity.
and
And there's a great website. It's Dr. Fung, Fung. He's a nephrologist from Canada. He has a great explanation of how and why they do it in different programs. It's not necessarily, there's a 16-8, there's a 12-12, there's 2 days. Kara, I wanted to ask you, because Knoxville uses Prolon a little bit more than we do up here. Prolon is a fasting mimicking diet. Do you just want to tell us a little bit about that?
It is a 5-day fasting mimicking diet. The first day is about 1,100 calories, and then the days after are about 700. But you can do anything for 5 days. But it comes in a box. It's numbered. You have exactly what you need to eat. They're actually coming out with a new one for our thyroid patients, an anti-inflammatory protocol. But it also has some long-term effects if you do it 3 times in a row, or 5 days, 3 months in a row. It helps with blood pressure, cholesterol, as well as a hemoglobin A1C. So some short-term, long-term effects.
That's a perfect way to close this out. You just talked literally about metabolic syndrome and how fasting mimicking helps all components of that. I think that's amazing. Listeners, viewers, we've had a great topic. I want you to read the doctor's notes, revisit this podcast. There are so many things contributing to belly fat, but I want you to know there are ways to get rid of it. It's not just through things that you're doing. It's a lot of the reasons are just genetic traits that add to it. So come get your hormones checked. Come see your favorite Mid Levels, the 4 of us, in 3 locations across East Tennessee. And thank you so much. Thank you, Fran, Kara, Amber. Thank you so much. And Ben, I don't know where he went, but
he's watching.
He's working on his belly fat right now, right?
Have a snack. Yeah.
Just a little bit of carbs. It's fine.
Yeah. Yeah.
All right. Until next week, guys. Thank you so much.
Bye.
Okay. Bye, y'all.
Bye. See you later.